breast conjoined.
Like a big basketball across my chest.
What happens when the bandages come off? And a woman wrapped up like a human Q-tip.
I am so full of joy.
She reveals why.
Plus, a young woman, her looks destroyed in a vicious attack.
I didn't get raped, but I got beaten to a pulp instead. Can
plastic surgery make her lovely once again?
Next time we talk, you're going to be awake with your new nose.
That's next. Now the story of a beautiful young woman on the verge of hitting the big time as a singer until a horrifying attack almost ends her life and leaves her face in ruins. We are there as she gets an amazing makeover from a top plastic surgeon.
I woke up in the hospital, police officer taking pictures of my face, and the first thing that he said to me was, "I'm sorry about your face." And that was what I woke up to.
Kate Kelly, a beautiful young woman, her future so bright and full of promise, needlessly cut short by a senseless act of violence.
It was an attempted rape, and I fought. I guess that's why I didn't get raped, but I got beaten to a pulp instead. They took everything from me in 1 second. I mean, one crack on the back of the head, and that was it. I remember grabbing my eye, and it was about 3 times the size that it was. My nose was over to the side. My tooth was gone. And I just remember sitting there with him, looking at the police officer and trying to find out what had happened. But he didn't have any details for me.
Kate grew up in a musical household, her proud father teaching her to play the piano when she was just a little girl. By the age of 4, the precocious toddler was already singing. Kate joined the school choir in elementary school, and when she entered high school, the then 14-year-old began studying opera professionally. By the time she reached 21, Kate's talent was undeniable. She had developed a 4 to 5 octave vocal range and had even secured a record deal. The young beauty's dreams of becoming a star seemed about to come true. But in the blink of an eye, those dreams were cut short.
After the accident, I went back down to a 3 octave range, and the label dropped me because I wasn't able to perform.
And the devastation didn't stop there.
It was several weeks of recovery. My nose damage was incredible. I mean, it's more of an internal thing. So a lot of the reason I'm here today is to be able to fix what's in there.
Because Kate's nose is never completely healed, she scheduled nasal reconstructive surgery with board-certified facial plastic surgeon Dr. John Vartanian.
When you look at your pictures, you notice that because of the accident, the bridge of your nose, the bony part, has been flattened. So we're going to try to restore its normal form by bringing those sides of the nose together so your bridge is thinner and straight. We'll also do some work on the tip and inside your nose just to restore some of that elegance that your nose had that was lost after the assault.
Dr. Vartanian examines Kate more closely to determine the full extent of the damage.
And I can see the septum, the partition in the middle of your nose, has been broken during the trauma. So we'll do some additional surgery inside your nose to help your breathing. And I can feel exactly where it was broken. You see actually pieces of bone missing here. Fortunately, it doesn't look that bad from the outside, but when you feel it, you can tell. I think we can make some good improvements here.
And with those improvements, Kate wants to be able to bring hope to others who have survived similar trauma.
I want to be able to bring a message to people through my music. I want people, girls, guys, anyone who's been through an experience similar to this to realize that, they can come out of it and you can achieve your dreams.
But how does Kate feel when she finally gets to the big day?
I'm excited. I'm really excited, but I'm starting to shake, I think, and I can't tell if I'm hungry or if I'm just really excited. But it's probably a combination of both.
Dr. Vartanian comes in to greet her and takes a last-minute look at her nose. He makes some reference marks to guide him during surgery.
You're going to meet with our anesthesiologist now, and he's going to put you to sleep, and then next time we talk, you're going to be awake with your new nose.
Yay!
Are you excited?
I'm so excited.
Good deal.
Thank you so much.
All right, cool.
And now, 5 weeks later, was Kate's surgery a success?
I'm so happy. I'm still a little bit swollen, which is expected, but I'm so happy. I'm just happy with how it looks. I'm mostly happy with the functionality, though. That's the most exciting part, just that it works. A lot of tears. You know, I think, I guess part of me, and I'm gonna cry now. It's been a real healing experience, I guess, overall, you know, physically and emotionally, which was, you know, the aspect I wasn't expecting.